Yeah.
Cool. All right.
All right. So obviously we've spoken about quite a few topics on the mental health side of things, and we'll get onto signposting in a minute. But one thing I wanted to touch on was from the religious aspect. I think mental health, obviously there's a bit of a stigma amongst black people already. I think sometimes religion can add a little bit more of a layer onto that as well. It can be a protective factor, but I think sometimes in some ways, maybe it can detract a little bit from people's ability to go and seek medical help, because perhaps they feel as though, you know, they've got purely the religious side of things, which is fine. You know, depending on your faith levels, you might completely go from a religious point of view in terms of managing any sort of mental health problems you have. My thing is more so just for empowerment almost, you know, and just to give people the heads up that even though obviously you've got your religious side, you've got your spiritual beliefs, you know, you do have a physical body as well, you know, and just as you would eat healthily and you wouldn't just, you know, pray away any sort of healthy eating and healthy living, for example, same way you would, you know, your eyes are going, bro.
You sure?
Yeah.
You sure about that? I think some people will try to pray away physical illnesses. Yeah.
Well, they don't, no veg. But I would say still, you know, even I'd say that's wrong as well, to be fair. And same way with mental health, it's about keeping your spiritual beliefs, keeping them core to you, using them to obviously sustain you, to strengthen your mind, to give you that solid foundation, but at the same time, making sure that from the physical side, you know, you are getting that assistance, you are getting seen as well from your healthcare professionals as well. Just because, you know, anecdotally, you know, I've seen people who, you know, people who have a lot of faith, or strong in their faith, but can still struggle from mental health problems. And perhaps, you know, because of their faith, felt as though if they go and seek medical care, that's almost them not believing in whatever belief they have. Which obviously is not the case. You know, as I said, if you had a cold, if you're worried about your health, you wouldn't not go to the hospital. Some people, as you said, some people might not, but for the majority of cases, I think you wouldn't not go to, you know, the hospital or your GP just because you are religious. So same way for mental health side of things, I think it's about getting rid of that stigma and realizing that, you know, it's fine to keep that religious foundation whilst also seeking some help from GPs and, you know, hospital care, etc.
Yeah, I agree.
Let's go into signposting.
Or probably before that, let's maybe touch on the impact that mental health or mental illness can have on friends and family, because that's obviously a big topic as well.
Yeah,
it's something that can be seen as a ripple effect, whereby it might be a child, it might be a partner, or close friend who has a condition, and it's essentially an unknown, and how the family member or the friend now has to deal with that. What are your thoughts?
I think, again, you're right. One of the biggest things is that most people might not even know how to deal with, let's say, seeing a relative going through a mental health crisis. And even from my experience, you know, you'll see that people come in, I don't know, you have like a 19-year-old and he's suffering from mental health issues. You come in with his mum, for example, and you can see even on the face of his mum that she doesn't really know what to do. She's lost. So I do agree that definitely people need to feel empowered, obviously, as individuals, but family members need to feel empowered as well, just in regards to what they should do and what services they can access, how they can even support as well. One of the worst things, one of the hardest things is seeing a relative who's suffering from mental health issues, because sometimes you don't even know what to even do. Necessarily. You don't know what to say to them to appease them. So definitely, I think it's worth touching on.
So I think it's important for people who find themselves in this situation to leverage the resources available to them. And I think one of the most important things is understanding the condition, and understanding that their loved one, whether it's their partner, their child, their friend, is not the condition. So to try to see them as more than this condition that's affecting them, ideally temporarily, you know, not permanently, so that if, let's say, they've got certain symptoms such as, you know, they're agitated, they've got a short temper, or they're withdrawn, they don't kind of take this personally, and they say, look, this is just temporary because it's the condition they have. So I guess that's one thing. And I think another important thing is to not go above your caring capacity, because then sometimes you need that validated by the other person. You need to see a positive impact to feel validated that I've done enough as a friend. And sometimes as friends, you know, our best isn't good enough. So it could be a friend who has depression and you're trying your best to be the one that's there for them. You know, I'm gonna, you know, maybe it's just a sense of, you know, some kind of complex where you're trying to go above and beyond to get them out of the depression. And, you know, depression is something that's complex, it's multifactorial, it impacts people differently. So if someone's got really hard to treat depression, it's going to require a very
specialist input in a way. Yeah.
Exactly.
Yeah.
So, you know, sometimes you need to do your best and accept that maybe your best isn't good enough, but not feel defeated.
Yeah.
Just feel, you know, I've done my best. I've shown love, and I'm now going to, you know, make sure they're in an environment where they can get more and the help they need.
Definitely.
As opposed to, you know, feeling quite upset, feeling angered that I'm trying so hard and, you know, they're not receiving.
Yeah, definitely. I think knowing that, knowing one's capabilities in that circumstances is important. And just sometimes just being that support system is perfectly fine.
Yeah.
You'll see that a lot of the times when you speak to patients and they have mental health issues, they're quick to name family members as, you know, some of their protective factors, we'll call them. And also people they can, you know, come to if they need anything. So definitely, I think most people will appreciate it, even if it's not necessarily going to treat their mental health issue completely or cure it completely. So definitely. What about services then? You know, we've spoken about services that family members can use and people themselves can access. What else, if somebody, for example, has a family member who's really struggling, they're feeling a bit overwhelmed, they're doing the most they can in terms of trying to support, what can they, you know, what sort of services can they access that will help them out?
So I think the first point, of course, should probably be the person's GP, okay? And I guess the GP, depending on how, you know, severe the symptoms are, can maybe consider referring to psychiatry, whether that's community mental health team, crisis team, who, again, work in communities to try to keep people out of hospitals. I guess worst case scenario, if they need to go to A&E, that might have to be considered. And then in terms of just, you know, raising awareness, there's rethink.org, which has lots of information for patients and carers in terms of conditions, signs and symptoms, I guess possibly treatments as well. And then there's another good resource called Hub of Hope, where you can put your postcode. You can also put in, let's say, conditions, and it can give you resources that can be used. And I guess another thing that can also help is if the person who has the condition has, let's say, kind of emergency crisis plan also. So they can essentially empower their loved ones to act on that in the event that, you know, they maybe lose their insight.
Definitely. And I think it's the urgency that is the driving force, really, because obviously, like you said, if somebody's got, you know, they're breaking down, they're having like a psychotic episode, let's say, that's probably not the time to go to your GP or to maybe be calling, you know, Samaritans. That's probably the time to go straight to A&E, for example. So definitely the urgency influences what you would do. But those are definitely the services to access first and foremost, and it probably will be GP majority of the time. And then they can get, you know, some involvement from psychiatry teams if necessary, if they can't deal with whatever the person's going through as well. Aside from that, anything else?
I think we've covered a lot, I guess, based on what people put in the comments. You know, we can always revisit this topic. We can always, you know, go into things in more detail, touch on different subjects. Yeah,
we definitely try to do the most common things that people might come across, or especially in the Black community, Afro-Caribbean community. I would say things that are definitely a bit more common. I think we touched on the majority of them, but there might be something niche, a bit more niche that people want us to address, which, as you've rightly said, leave in the comments. We'll do that, definitely. But if not, we'll sign off.
Yeah.
Guys, thank you very, very much again. As we always say, like, comment, subscribe, you know, everything. We'll be back sooner rather than later. We're trying to increase the volume up, be a bit more active. So you see us soon. Yeah, take care.
Cool.